Good afternoon, everyone. Today we have with us Dr. Lekita Raikar, who has completed her Bachelor of Physiotherapy from KLE Institute of Physiotherapy, Belgavi, and her Masters of Physiotherapy from Goa Medical College, and has specialized in community physiotherapy and rehabilitation. Today she will be speaking upon interferential therapy. We welcome you, Dr. Lekita. If anyone has any questions during the session, please keep your questions towards the end and keep your mic muted to avoid any disturbance. Over to you, Dr. Lekita.
Thank you. So, today's topic is interferential therapy. Before that, I would like to this disclaimer is important, as this talk I'm giving is educational purpose, and whatever the topics I'm going to speak are based on my opinion and according to my best knowledge of mine. So whatever is present in the videos or photos, it is not related to any trading advice or anything. So this is my disclaimer for the presentation. Starting, so objective for today's presentation is we'll understand the principles, mechanism of IFT, that is interferential therapy. Then we'll learn the technical aspects and setting of the IFT. Then we'll know the neurophysiology or physiological effects of the IFT. Later on, we'll know what are the indications, what are the contraindications, and what are the precautions to be taken. And at last, we'll review some clinical applications, evidence-based practices, and recent advances. Coming to introduction. So, interferential therapy is a medium frequency electrotherapy modality. So, this is primarily used for pain relief, muscle stimulation, and to improve the circulation. This works on principle of interference. So, interference of two currents which will produce a low frequency therapeutic effect. Now, let us come to a definition of what is interferential therapy. It is the use of two medium frequency alternating currents which intersect and interfere within the deep tissues to produce a therapeutic low frequency current. Now, let us come to the principles. So, as I said, there are two medium frequency currents used. So, it can be 4000 Hz and 4000 and 100 Hz. So, now these two medium frequency currents crosses each other and interfere in the body tissues. As you all can see in the image, so there are two electrodes, two channels, which each electrode is connected in a position so that it intersects each other in a deep tissue. Now, as a result, a beat frequency is produced at the center, that is between in range of 100 Hz. Now, this beat frequency provides a low frequency stimulation at the deeper tissue levels. Now we'll see what are the different types of IFT applications. There are bipolar, quadripolar, vector scan, and static. Now, what happens in bipolar? In bipolar, only two electrodes are used, that is, only one channel is being used. And there is pre-modulated current within the machine. It is set up within the machine. Now, next is the quadripolar, in which it says itself it is the four electrodes is being used, and there is classic interference seen here. Now, what happens in vector scan? In vector scan, similarly there are four electrodes used, and the application is usually used when you want to treat a larger area surface. Example can be a low back. So in the picture, as you all can see, so this is placed in a vector scan position in which there is field is been created all over the area when we want to cover a larger area surface. Next is static. In static interference, the area in which IFT is placed, it remains stationary. So there is no rotating field in this. The current which is applied, it is stationary at one place. This can be applied when there are any trigger points. So further we'll see it. So now we'll see the electrode placement. So first is what I said was the bipolar and second is quadripolar. So quadripolar, there is diagonal positioning for interference. Second is bipolar. So in this a current is modulated within the machine and only two electrodes are being used. For this example can be a elbow joint where example can be a tennis elbow wherein we want to treat the ligament and wherein two poles of the electrodes are being used. Third one is targeted placement. So this means over trigger points or a muscle belly. So this works on the application that is the static placement. So the current is at the static stationary at one point. Now we'll see what are the parameters of this machine IFT. Now there is a carrier frequency which is 4000 Hz. Then there is a beat frequency that is in between 1 to 150 Hz. And then comes the sweep frequency. Sweep frequency is basically used to avoid accommodation which varies the beat. Further we'll see why is being sweep used. And treatment time is 10 to 20 minutes. And the amplitude, it is based on the patient's tolerance. So it usually should be strong enough and it should be comfortable to the patient. Now we'll see what are the effects of this frequency. Different frequency can have different effect on the tissues. First one is 0 to 10 Hz. So this frequency can be used when you want to stimulate a muscle, that is used for muscle stimulation or muscle activation whenever you want to activate certain muscles. So that time you can use this frequency. Second one is, yes.
Yeah, we were not able to see your presentation, but it just now appeared. Sorry, yeah, thank you.
Can you see it right now, what I'm explaining? Or
yes.
Should I go back?
We can see it now.
So before I had explained the parameters of IFT, and now I am focusing on what are the frequencies used for what effects it can have. So next, second one was 10 to 20 Hz. So when you want to treat a patient and when you want to increase circulation in particular region, so that time 10 to 20 Hz of frequency can be used. Third one is 20 to 50 Hz. In this frequency, you can be useful for muscle relaxation. Next is 90 to 100 Hz. This frequency is used for pain relief. So how it does pain relief? It works according to the gate control theory that I'll explain further. Then next is 130 to 150 Hz. this frequency can be used for edema reduction. So there are two modes, that is sweep and vector mode. So in sweep mode, as I said, so this helps to prevent accommodation of a current. So it changes the frequency. So ideally it is 0 to 150 Hz. It keeps on changing the frequency so that there is no accommodation of the current. And this sweep frequency is directly fed to the beat frequency by the machine. So in that way it can change the frequency. Next mode is the vector mode. So as we saw in the vector scale, so in this what happens is it moves the current in a field dynamically in the tissue. So what does this helps us? It helps in enhancing the coverage and comfort to the patient. Now we'll see what are the physiological effects. First one is pain relief. So activation of pain gate control mechanism. So as we know, the pain gate, so whatever there is a pain stimulus coming to us. So it can be a deep touch, painful pain break. This stimulus has effect on a nociceptive receptors. So what does this nociceptive receptors do? So this send the signals to a spinal cord through the fibers, through two fibers, physically that is a delta and C fibers. Now what happens in the spinal cord is it enters from the dorsal horn where there is substantia gelatinosa. So over here there is other cells present which can inhibit the this pain pathway. So further from the spinal cord it goes to the cortex, and then the efferent fibers have been sent and then we perceive the pain. This is the normal pain gate. Now what happens, how this EFT machine helps us is this sends this current is a low frequency current, as I said. So this activates the large diameter myelinated fibers. So what does these fibers do? These fibers activate the cells present in the substantia gelatinosa, which gets activated and then it inhibits the pain gate pathway, and here it stops the signal to go to the higher centers. So in this way the pain is relieved and it activates the pain gate control mechanism. The other mechanisms are through endorphin release, and also it decreases the nerve excitability. Second effect is increases blood flow. So there is rhythmic contraction of the muscle. So what happens, there is pumping action is produced. So this has effect on the blood vessels which are passing which have been passing which are supplying the muscles. So this has effect on these blood vessels, and then there is increase in circulation. So as there is increase in circulation, so the other effects have been seen, that is reduce muscle spasm. So as the blood circulation increases, it also helps to absorb the exudates, and also it promotes in tissue healing. Now what are the indications. So this is widely used for relief of pain, as I said. It can be used in low back pain, periarthritis shoulder, osteoarthritis knee, chronic ligament injuries, fibrositis, neuralgia, sprain and strains, and also used in chronic edema, that is swelling. Also, it is used in cases of hematoma during the first 24 hours. With ice pack, if it is used, it is very helpful to be give a better results. So at last, it can be also used in incontinence. That can be stress incontinence or urinary incontinence. So as you all can see in the pictures, I have shown the placements of neck, knee, and the last one is for the incontinence. What are the contraindications? So contraindications are over the pacemakers or any implanted devices, in pregnancy especially abdomen or lower back, then cancerous lesions, thrombophlebitis or open wounds without any dressing. Now, what are the precautions to be taken before we apply the IFP? So first you have to check for the skin integrity. Then there should be proper contact between the electrode and the skin. Third is the intensity should be monitored during the treatment. And lastly, you should avoid applying the electrodes on the bony prominences for better comfort. So what are the advantages of this machine is it has deep tissue penetrations, comfortable stimulation, it can be used in both acute and chronic cases and also it is non-invasive and drug free. So it also has certain disadvantages. It can be like it requires a careful electrode placement. Then some patients may not tolerate the sensation. Some patients may have some sensory issues. So it is also not suitable for all areas. For example, face and all. So these are some disadvantages. Now we'll see some evidence-based practice. First one is interferential current therapy improved constipation and pelvic floor muscle activity in cerebral palsy children. So in this study, 9 CP children were taken in the age group of 4 to 13 years who had constipation. So outcome measures used were pediatric incontinence and constipation score, pediatric quality of life, and pelvic floor muscle activity. So they received a standard lactulose therapy and a interferential current therapy with a frequency of 4000 to 4100 Hz. Duration was 20 minutes. It was given 3 times a week for a 4 week, that is a month. So in this study, improvements were seen in the constipation, pain parameters and pelvic floor muscle activity, which had been reduced significantly at rest. Next one is the analgesic effects of interferential current therapy. So, as I said, IFT is a medium frequency alternating current which has been reported to reduce the skin impedance and can reach a deeper tissues. Also, it has provided several different treatment possibilities, adjustments in the parameters. That is, we can adjust the carrier frequency, amplitude, modulated frequency. Also, we can adjust the sweep frequency. We can change the mode according to the condition, and it can be applied in different positions, that is bipolar, quadripolar, according to the area of the treatment. and also time of the application and intensity. So the literatures have been shown that there has been significant analgesic effect in patients with neck pain, low back pain and knee osteoarthritis and post-operative knee pain. It was a narrative review, this study, in that they have found this analgesic effects. The next is interferential current and photobiomodulation in knee osteoarthritis. It was a randomized, placebo-controlled, double-blind clinical trial. So in this, the patients were divided into 4 groups. First was interferential current, second photobiomodulation, interferential current plus photobiomodulation, and a placebo group. So they were received 12 sessions 3 times a week, and the treatment duration was 30 minutes of interferential current followed by photobiomodulation, active or placebo. The results were interferential current plus photobiomodulation has shown reduction in pain intensity at rest and during movement compared to placebo and interferential current. There was some recent advances on it, that effect of interferential current treatment on pain, disability and balance in patients with chronic low back pain. It was a randomized controlled study. In this, they they had investigated for the improvement of pain, disability and balance. So they divided the patients into 2 groups, that was interferential current group and a placebo group. So in the intervention group, they received 30 minutes of the IFT treatment on the lumbar region, and in the placebo, they received IFT treatment without real electrical stimulation. This was given for 5 days a week for 2 weeks, and the findings showed that it improved the pain, disability and postural sway, thus highlighting the benefits of somatosensory stimulation from the interferential currents. Next one is current treatment on knee osteoarthritis. It was a pilot randomized double-blind study comparing the effect of different carrier frequencies. Here they aim to investigate the effect of different carrier frequencies of IFC treatment on visual analog scale for pain and WOMAC, a 10-minute walk test and the amount of paracetamol taken. Now the patients were divided into 3 groups. Okay, the patient with knee osteoarthritis. First group was 2000 Hz, second group was 4000 Hz and third group was 8000 Hz. So these were the frequencies of the treatment they were receiving. So it was given for 20 minutes 5 times per week for 3 weeks. And with this, they were also prescribed home exercises program. So this study concluded that it showed significant benefit for all the different carrier frequency groups, but were not able to show any to be superior to the others. Let's take up a case example. So patient comes with a 42 years old male, is an office worker, comes with a pain of sharp localized pain in the lumbar region following lifting heavy box, and the complaint is the pain is since 2 days. Now the pain score is on VAS 8/10. Physical findings was muscle spasm present along the spine. there is limited range of motion in flexion, and there is no neurological deficits. So treatment protocol, it can be IFT using 4-pole classic technique, carrier frequency 4000 Hz, beat frequency 80 to 100 Hz, duration 15 minutes, intensity strong and comfortable to the patient. So results seen were like at the session 3, VAS score was reduced to 5/10 and was able to work for longer hours with reduced pain. So with this, I would like to end today's session. If anyone has having any questions, they can ask now.
Lilita, can you hear me?
Yes.
Yeah. So it was a really nice presentation. You explained everything quite well, especially the case studies, and you did a actual case presentation. So that is how it should be done, and that I think you have done a very good job. I know electrotherapy is our basics. It's our I think it's our first year and second year topic. And but what happens over time, we look at more complicated things, and we forget our basics. So that was one of the reasons I wanted this presentation done on electrotherapy. And I think you did a very good job at it, and I think you covered everything. So good job.
Thank you, Dr. Lekita, for that insightful presentation. Does anyone else have any other questions? If not, we will be concluding this session. Thank you, Dr. Lekita.